Has someone you love started showing subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, a single, unexpected event. But the truth is, the body often sends quiet warnings for months, sometimes even a year, before life reaches its final stage. The problem is, most families miss these signs because they seem small at first. It's only later, looking back, that they realize the clues were there all along. But by then, it can feel too late. Too late to prepare. Too late to have those final, meaningful conversations. Too late to make those last memories count. In this video, we are going to talk about 5 key signs that often appear in the year before an elderly person passes away. Some of them might be things you've noticed but brushed off as just normal aging. Others might be changes that seem minor, but actually signal the body's gradual final decline. Recognizing these signs is not about giving up hope. It is about gaining the clarity and opportunity to provide better care, to cherish meaningful moments, and most importantly, to ensure that your loved one's final stage of life is filled with as much comfort, dignity, and peace as possible. Stay with us until the end, because understanding what's happening allows you to move from a place of fear and uncertainty to a place of informed compassion. The 5 key signs of life's final stage. Number 1. Unintentional and significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintentional weight loss. At first, it might seem subtle, a belt that suddenly needs tightening, clothes that appear looser, or a once hearty appetite that begins to fade. Many families dismiss it, but the truth is, losing a significant amount of weight without trying is rarely a good sign in an older adult. This often indicates that the body is no longer absorbing nutrients efficiently from food, a condition known as malabsorption. At the same time, the body may enter a state of cachexia, a complex metabolic syndrome associated with underlying illness where the body loses muscle mass even if caloric intake is stable. This loss of strength doesn't just make movement more difficult. It severely increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections that their body can no longer fight. Another profound reason for weight loss is a natural change in appetite. Many elderly individuals simply don't feel hungry the way they used to. Their senses of taste and smell can fade, making food seem bland and unenjoyable. This isn't just a matter of preference, it's a deep physiological shift. The body, sensing that it's beginning to shut down, no longer sends strong hunger signals to the brain. The result is less energy, less strength, and a gradual decline in overall health. Of course, weight loss is also a common symptom of progressing chronic diseases like cancer, congestive heart failure, or end-stage kidney disease. Even conditions like depression or worsening cognitive decline can lead to a reduced interest in eating, causing a downward spiral. Some families try to solve the problem by encouraging their loved ones to eat more, but if the weight continues to drop despite these efforts, it's important to recognize that the issue is not just about diet. It's about the body preparing for a deeper transition. At this stage, forcing large meals is not the answer. Instead, the focus should shift to providing comfort, offering small portions of easy-to-eat, nutrient-dense foods, and ensuring proper hydration to maintain quality of life. Number 2. Profound fatigue and pervasive weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that is not relieved by rest. This is not just feeling a little tired after a long day. It is a profound cellular exhaustion that makes even the simplest tasks feel overwhelming. Getting out of bed can become a monumental challenge. Walking across the room requires significant effort. Activities that were once routine, like cooking or dressing, start to feel too draining. This isn't just a result of aging. It's a sign that the body is actively conserving its remaining energy. As the function of major organs like the heart, lungs, and kidneys begins to slow, the body starts prioritizing only what is most essential for survival. The heart doesn't pump as efficiently, circulation weakens, and muscles no longer receive the same level of oxygenated blood they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to sustain any level of activity. Their metabolic rate slows down, and the body's energy is redirected away from fueling movement and toward preservation. This is why someone in decline may start sleeping more, needing longer and more frequent naps during the day, and finding it harder to stay awake for long periods. Perhaps the most heartbreaking part of this process is the emotional impact of the fatigue. Many seniors who once took pride in their independence begin to feel frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations and social interactions, not because they don't care, but because they simply do not have the energy. This can lead to a cycle of isolation that only accelerates the decline. For families, forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. Number 3. Increased cognitive confusion or social withdrawal. As a person approaches the final stage of life, one of the most striking changes can be seen in how they think, communicate, and interact with the world. You may notice that someone who was once sharp and engaged starts to forget things more often, struggles to follow conversations, or seems disoriented even in familiar places. They may repeat the same stories, forget names, or lose track of time. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady flow of oxygen and nutrients to function properly. As circulation weakens and the oxygen supply to the brain decreases, cognitive function starts to decline. The person may become easily confused, have difficulty making simple decisions, or struggle to recognize people they've known for years. In some cases, they may even have brief moments of lucidity, followed by sudden episodes of deep confusion, as if their mind is fading in and out. Another common and often misunderstood sign is emotional or social withdrawal. Someone nearing the end of their life often loses interest in social interactions. You might notice them speaking less, engaging in hobbies less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones. It's that their brain no longer processes emotions and social engagement in the same way. Conversations become tiring, and loud environments feel overwhelming. You may also notice changes in mood. Some individuals become more irritable or anxious, while others seem unusually calm and detached. This isn't just a personality shift. It's often a result of the brain adjusting to the body's decline. For family members, this stage can be especially difficult. It can feel like you are losing the person you love before they are actually gone. But it is important to remember that this is not something they can control. Instead of trying to force conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance through simple touch, and understand that even if they don't always respond, they can still feel your presence. Number 4. Frequent infections and slowed healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, flu, or small infection that goes around. What used to be minor illnesses now take much longer to recover from, and simple wounds like a small cut or bruise heal at a noticeably slower rate. These changes aren't random. They are signs that the body's defense and repair systems are failing. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, and skin infections become far more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently, it's often a sign that the body is losing its ability to fight back. Even antibiotics that once worked quickly may seem less effective. Another overlooked issue is the presence of chronic wounds. If you notice that small scratches or sores aren't healing properly, it could mean that circulation is severely compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower. For those who are less mobile, pressure sores become a serious risk and can lead to dangerous systemic infections if not managed carefully. What's even more concerning is that infections in the final year of life often don't present in the way we expect. Instead of a high fever, an elderly person may simply seem more tired, more confused, or less interested in eating. For seniors, a sudden decline in mental alertness is often the very first warning sign of an infection, appearing long before other symptoms. This is a time when the focus often shifts from curing to comforting. making sure they stay hydrated, keeping their skin clean and minimizing stress on the body. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or more shallowly than before. At times, they might pause for several seconds between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes. This mottling, known as livedo reticularis, happens because the body is prioritizing blood flow to the most vital organs, reducing circulation to the extremities. It is a clear indication that the heart is no longer pumping as strongly as before. Some people also experience more shortness of breath even with minimal movement. Simply sitting up or speaking might cause them to feel winded. You may notice them breathing through their mouth more often. In some cases, fluid can build up in the lungs, making breathing more difficult. This can cause a persistent cough or gurgling sounds. For family members, seeing these changes can be frightening, but in many cases this is simply the body's natural way of slowing down. The focus shifts entirely toward comfort, keeping the room cool, using a humidifier, elevating their head with pillows, or offering small sips of water can help ease discomfort. As we come to the end of this video, take a moment to reflect. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, but when you start noticing them, it is a sign that the body is preparing for its final transition. Understanding these signs isn't about fearing death. It's about being prepared for it. When you recognize these changes early, you can offer better, more compassionate care. You can make important decisions ahead of time, and you can ensure that your loved one's final months are filled with love, comfort, and dignity. This is a time for cherishing quiet moments, sharing stories, and letting them know they are valued and not alone. If you are noticing these signs in someone close to you, take a deep breath. You are not alone in this journey. Thank you for joining us today. If this video gave you something helpful or hopeful, please like this video and share it with someone who might need to see it. And if this is your first time here, consider subscribing so we can continue to explore these important topics together. We'd love to hear from you in the comments below. Thank you for watching.